Hello everyone, this is NAINAMD, Beverly Hills. I'm Dr. Naina, and my show, this is the first start of my first show. I'm really excited because it's going to be called, it's called NAINAMD, Fusion of Science and Beauty. And the whole idea is to let you guys know about what's the latest, greatest in anti-aging, and that it's really becoming an amazing specialty. We're combining the term regenerative along with it because as we're aging, we're realizing that we can actually partially reverse the aging process. And I'm going to have the most amazing guests coming on. Again, I'm so excited about the show. And I want to introduce you to my first guest is Dr. George Graf of Beverly Hills. He's a pain management doctor and anesthesiologist. And how are you?
I'm happy to be here.
Thank you.
Looking forward to sharing some of the things that we're doing.
I know. So a lot of times pain is like, you pretty much treat it with pain medication, right? And if the pain gets worse and worse, then you're on to epidurals. We give you, or you give corticosteroid shots.
Yes.
A lot of times people don't get relief with that. They kind of do, and then it kind of fades out. And they're in this like, all the time they're in this cycle of like, okay, I think I'm getting better, and then no, I'm not. And then you give more pain medications and different kinds of pain medications. And that's really pretty much been the traditional treatment. And now people are realizing maybe a little bit of acupuncture can help, doing some yoga, some meditation. But what in terms of anti-aging? That's the key thing. In anti-aging, what are you doing? I heard about the stem cells. I mean, that's so exciting about stem cells and PRP. Can you explain that?
Yes, of course. It's a real shift in the paradigm. As you just mentioned, everything up until this point has been managing pain. And we're doing nothing really to reverse the cause of the pain. Right. So as long as people have something wrong that causes pain, it's actually the most frequent diagnosis for people who visit doctors. And we're often just helping them manage it, but we're not really changing it. And trying to find a way to break the cycle between what's wrong and what's causing the pain is the best we can do in terms of helping people reduce their disability and return to work or live happy lives. So now
and quality of life is so important, right?
Very important.
And everyone's like, the people in chronic pain, there's no quality of life for them. Very little. They're always in pain. Every single day they wake up in pain, right?
Yeah, it's a real shift in the paradigm. We're now looking at the possibility of not only treating pain, but helping regenerate and improve people's conditions.
Exactly.
The most obvious place where we started are the most frequent things we see, and those tend to be sports injuries and major kinds of arthritis, the most common one being degenerative joint disease of major joints like the hip or the knee. And we found now that by using different kinds of substances that come from our own bodies, that we can change things and actually improve people's conditions, and in so doing reduce the pain.
Is that what people are like talking about, like stem cells, like your own, that you can, from your own body? Because, you know, a lot of times like people have this concept like where the stem cells coming from, sometimes from your own body or sometimes from maybe other sources where where it's acceptable in terms of the FDA and so forth, some other sources. So those are can you tell us what stem cells are? Because I think a lot of the audience don't even know what stem cells are.
Yeah, stem cells are the most primitive cells in our bodies. And when we're in utero, before we're born, stem cells differentiate into every other kind of tissue in our body. We continue to produce them throughout our lives.
So that means like if you give them for arthritis, let's say you could put them in the knee, then they're going to differentiate into all the knee, right? All the things that the knee needs to build, to make, like cartilage and all of that.
That's exactly right. The stem cells that we can harvest from the bone marrow are called mesenchymal stem cells. And they can differentiate into just about everything we have use for them now.
So how do you do that? Like, so let's say a patient with pain comes to you, right? The patients are like tremendous amount of pain. Let's say they're having like really bad knee pain. Okay, so or back pain. Do you do it in backs too?
Yes, we do.
Okay, so let's just take the back pain because that's so common, and people, like I see guys can't even work because they're out of work. And they can't even do, these are construction guys or guys that are like, you know, doing, having to do lifting and bending every single day, and they're like totally in pain doing it. So he comes to you. Where do you, what's the procedure like? What do you take would you go from the bone marrow? Just describe it.
Well, let's talk about, you know, both of the situations you mentioned are acceptable. After we take a history and examine the patient and look at all their data, if we think they're an appropriate candidate,
right.
And by that I mean that their disease isn't so far gone that there's no way to regenerate, but if they have mild to moderate disease wherever it is, and we think that they may respond to an attempt at regenerating whatever it is that's the problem, we'll go ahead and talk to them about the procedure. Now that includes harvesting the stem cells, and we can do that very easily from their pelvis. There are big bones down there, and there's lots of stem cells in their bone marrow.
Nowadays they've got needle, right? You don't have, nowadays it's like you can do it pretty relatively where it doesn't hurt hardly, right?
It doesn't hurt at all.
Because everyone's like, oh my God, you're going to go into my bone marrow, right? Everyone's like, says it's so painful, but you guys, I know, do it in such a way that it's like minimal pain.
Very
right?
little. We give a little sedation. We have people come in, we use local anesthesia and very small needles. We go in. It's almost...
that's really nice, local. There's no general, right? Perfect, perfect.
And we draw out the bone marrow.
Okay.
Then we put it in a centrifuge, and we separate the bone marrow from the plasma. And then we take that bone marrow, and we can inject it.
And then that has all the stem cells, right? That's got all the stem cells.
And not only that, but there are other tissues in there that will
right, like growth factors and
release growth factors and healing factors.
So growth factors are substances that actually help the stem cells to do what they need to do.
Yeah, there are two processes taking place. When we inject stem cells, we're looking for them to differentiate and actually become the cells that are needed for regeneration. In the case of arthritis, we're talking about articular cartilage, the cartilage that lays down in between a joint that becomes very degenerated. Those stem cells can go in there and start laying cells down.
That is cool. That is really nice.
In addition, what you said, those healing factors go along with that.
Yeah.
So there's two processes taking place at the same time, all helping.
Yeah. And and the cool thing about it is it's in your own body, right? So it's like you're getting the bone marrow from your own body. It's your own tissue, pretty much doing, but it's just put in a place, in a different place, right?
Exactly right. What we're doing is we're concentrating into very high concentrations, things that are already in your body. Those stem cells will go to a place where there's inflammation and disease, but in the concentrations we are able to get when we harvest the stem cells, there's no way we can ever get that many stem cells in one place at a time. So it's really a very, very nice technique to help people who have manageable disease.
Yeah, and then that gets into a whole host of other things, is because with that stem cells, then that's what I do. I come in and I say, okay, let's balance your hormones. Let's make sure that your nutrition is good. Let's make sure everything else is optimized so that those stem cells have a chance to survive, right? And because you give such high concentration, you're going to get a great result, but you get even a greater result if you change a little bit of your lifestyle.
Well, what I think is really wonderful that you do is, in the United States, we take stem cells, we harvest them, and then we need to give them right away without any manipulation, without any growth.
That's how the government defines it, yeah,
and
the FDA.
When you come along with the things that you're able to give, it makes the potency of those stem cells even greater, and their viability improves, and therefore we improve the chances that we're going to have a positive result.
Gee, that's fabulous. Listen, how does the audience come and see you, and do you have a website?
Yes.
What's it called?
Well, my website is Intelligent Pain Solutions.
That's a really nice name. That is really nice, because if you're smart, you're going to go for the stem cells.
Well, I hope so.
Yeah.
And you know, we do a number of things there. We do more traditional things, and I also do addiction medicine, so I help people actually get off pain medicine, because I'm a big believer in only using pain medicines when they really need to be used.
Exactly, exactly.
And Dr. Raj, my partner, is a wonderful
He was supposed to be
orthopod.
on. He was supposed to come today too, right? But he had a little bit of an emergency.
He's busy.
Yeah.
But he injects just about any joint, and I try to pay attention to the spine from the cervical all the way down to the sacrum. And so we work very nicely together.
Well, I love that you were able to come on. And tell me one last thing. When you have a patient that's like in just so much of pain, right? And you've done the procedure, compared to what you did, let's say, 10 years ago, do you see a difference on the people that you are doing this procedure
Well, when
with?
we select patients, and we pride ourselves in selecting patients very carefully. We want patients to get better.
Yeah.
This is a longer-term process. You can always give someone local anesthesia or a pain medication and reduce the discomfort immediately.
But that's a quick fix.
But that's
quick
just
fix.
masking the pain.
And it's a quick fix. It's not a permanent fix.
When we give stem cells or PRP, platelet-rich plasma, over 4 weeks, 6 weeks, 8 weeks, we'll actually see improvement in their condition. Not only does that result in less pain, but it also results in an improvement in their underlying problem.
Wow, gee, that sounds amazing. So I'm so glad you were able to come. And again, this is the awareness. Again, how many people really know what stem cells are? How many people know that there's a procedure like this that is available? And we want to make this mainstream, because this is anti-aging and regenerative medicine is here. It's here and now.
We're trying to educate people, and that goes for not only the public, but professionals as well.
Yeah, absolutely. Thank you so much for being here.
Thank you for having me.
This is NAINAMD of NAINAMD Beverly Hills Fusion of Science and Beauty. Hi everyone, this is Dr. Naina of NAINAMD Beverly Hills Fusion of Science and Beauty. I'd like to welcome you to my next guest, Cindy Greer, and she is going to help us all to introduce the concept of bioidentical hormone replacement therapy. Now, what bioidentical hormone replacement therapy is it's the use of natural hormones that are totally bioidentical, meaning the same chemical interplay, same chemical substances that you would normally have in your own body. These are the same type of hormones. They're generally derived from yam plant based. So these help us to age less. They help to rejuvenate us. They fix so many problems. And Cindy's going to share that with us, exactly what it did for her. So Cindy, would you like to share your story about how you were even introduced to bioidentical hormones, and maybe how it might have interplayed? So we're mentioning something about headaches. So tell us your story.
I started out kind of going through premenopausal symptoms, and so I went to the
When
health.
was that? That was like about?
In my middle 40s, actually.
So that was about like a little while ago. Okay.
So, of course, at first I went into the health food stores and was doing some creams and things on my own there, and for a while that worked. That was good, but symptoms started
those like
increasing.
yam-based creams?
Yes, yes.
Okay.
And at first that worked, but then the hot flashes started, the night sweats where you're changing your clothes in the middle of the night because you're just wet.
And nobody understands this, right?
And then I started noticing my hair was thinning in a couple places. So then I wasn't into the computer like I am now, but I got the books. And I started reading, and I went to a great medical doctor, and he put me on, I believe, progesterone. And I took it as a troche.
So the troches are the things that you put under your tongue?
Yes.
Yeah.
And I really did not see a lot of change, except within a year I was developing cavities. And I asked the compound pharmacist that made them, and they told me that usually they had no challenges with that, but because I wasn't seeing good results from that, then I was talking to a friend at school where I taught, and she mentioned a hormone guru, is what she called her. And I started with her, and she started showing me that when you do the blood work, you don't just look within what is in the natural, normal range. You've got to tweak that down even closer. And she did very well, except within about 6 months, I may be spotting. I may have the hot flashes coming back. And then I did more research on my own that you need to be watching it more closely than that, than once a year.
So you know hormones. The thing about hormones is that too much of a hormone and too little of a hormone can pretty much do the same thing. And that's where people don't understand it. So you could be like doing the same thing, but there could be certain things going on in your body that you're metabolizing differently, and you don't know where you are then. So you just can't like leave everything, think everything's going to be the same year after year, or even 6 months later, right? You got to figure out what's going on, what else is going on in your lifestyle. So that's probably what happened. So anyway, go on with your story then. You weren't doing as good. Then what happened?
Not doing as well. The hot flashes and the night sweats slowed down a lot. The migraines decreased. The hair was getting back to where it was again, and I was feeling more like Sydney again, and not just days that kind of did this. Well, then a very exciting thing happened in my life, and a hero of mine for many, many years, his wife passed about 5 years ago, and he lived out here in California, and I am from Kansas. And he called me on the phone and told me that his wife had passed about 3 years. And he was wondering if I would be interested in seeing if we would like to take our relationship further than an acquaintance friendship. And
he was your prince.
He was my prince and my knight in shining armor, though, you know, that was from a distance. But yes, he asked me.
Where did you guys meet?
We met many years ago in Oklahoma at some meetings.
That's amazing, because he's in California.
He's out here.
And you're in Kansas, and you meet in Oklahoma. Wow.
And we met in Oklahoma, and he did a lot of ministry in Kansas.
Would you please share with the audience who your husband is?
My husband is Rosie Greer.
He's amazing,
and
an amazing man. Oh my gosh, I have so much respect for him.
He is great. He's a former NFL football player, but more than that, he has a heart that is incredible and loves to work with the inner city children.
He's done so much.
He is still going. He has written a book just recently and doing a CD, and you and I have even talked about some hormones for him, because what happened when I came out here was I changed environment. I had lived in the Kansas type of environment since birth. Family had kind of moved away, so that wasn't a big adjustment, but coming out here and having no family or friends other than my wonderful husband.
Just different, just the pollution here, and to have to deal with a whole different set of, issues.
So the migraine started really...
I think that's about the time when you came to see me,
yes. Right? Oh, the migraines were just... And I was to the point I had used up all my prescriptions from Kansas, and I wanted a hormone therapy doctor that would give me options, not just say, this is the way I'm going to treat you. You're going to look at me and help me decide, the two of us together, what's the best thing for Sydney. We decided on your adrenals. We looked at all of the things. That's the thing in hormones. You can't just look at one thing. You have to look at we have to look at adrenal glands. We have to look at what your environmental issues are. We have to look at everything, your gut, everything comes into play. And that's really what functional medicine is. So in anti-aging medicine, functional medicine that looks at imbalances and tries to figure out why is this person having these issues, rather than, okay, here's a pill, take it, see you later. It's not acute. It's not quick fix anymore. And that's the whole concept. So you got actually rid of your headaches, didn't you? Headaches almost completely disappeared.
And you had them for almost 20 years or something
20
like that,
years, and sometimes they were every day. I'm talking about go to bed at 1 o'clock. So you're not having much of a life with your children and other things.
Imagine if you knew this at that time,
And hopefully we learn more from wisdom and knowledge than just experience as we go through. I was telling Rosie, I said, you know, Dr. Naina has taken more blood work and done more tests with me in the time I've been out here than almost in my life, but the results, and because you were so thorough, I mean, there have been other things. I think my skin has improved also.
You look amazing. Your skin is such a glow.
I actually never ever thought of myself as feeling old. I've always felt young, and I exercised and did all these things. But you got me balanced again in every way, like you said. You know, the
from
bloating.
Yep. It was from the inside out.
Exactly.
So what you do is you fix the inside, it has effect on the outside. And hormones like estrogen, but you give the natural, the yam-based. You don't give the one that's, you know, from the horse's mirror urine, right? Everyone thinks it's the same thing. It's not. Even our journals. I mean, when I go and lecture and speak about it, I talk. We have so much evidence that there are different kinds of estrogens. There are good and bad estrogens.
Yes.
But estrogen is a very important hormone. It helps you build your collagen, your elastin. Same thing with progesterone, helps you to sleep. Has so much even helping like in the central nervous system. Then there's testosterone. You know, women are losing 0.4 pounds of muscle mass a year. They need to have their hormone testosterone. And testosterone, very small amounts of it can help maintain your muscle mass. And that's your #1 biomarker of aging.
Yes.
So how come we aren't even looking at that? And so when we did all of that for you, that's why your skin got better, your stomach issues got better, your headaches got better, and then, wow, you're like, I just thought I was coming for hormones, and suddenly a lot of other things start happening.
Well, Dr. Naina, you look at the whole body. See, we're not just a physical piece. We are a spirit. Yes. We have a soul, our mind, will, and emotions, and then we have the physical body. So if a doctor, or even if I am not looking at that, or the whole body, something is going to be off balance. Something is not going to be taken care of.
You have to be proactive with your patient, and that's the whole awareness of anti-aging and regenerative medicine, is saying, listen, start listening to your patients. They're actually, my patients are very, very smart. And oftentimes we come up with this notion that the patient doesn't know anything. Of course they know everything. And we just have to listen and then just sort of look at the biochemical imbalances. That's what it's all about, right? Well, I'm so glad you came on. I mean, I think it's so important for you to really be, I'm going to make you the spokesperson for bioidentical hormone replacement therapies. And
as I live to be 120.
Yes. Last time you came on one of the times that we were together, you had the most amazing outfit on. You had these amazing shoes. Today, can you just tell me what these shoes are incredible? They're like alligator shoes. They're beautiful, and your outfit's amazing, and you always look fabulous. And I think part of it is just feeling like, right? You feel good inside, and you just look amazing outside.
Well, and I have a relationship with God and with my husband, and I like him to help dress me. Yeah. Like today I'm leaving and he's going, oops, that pair of hose isn't going to work. You know, fabulous. He notices, he listens, just like you do. And that's what we all need to be doing with each other too. To be reaching out and listening and helping each other. So thank you so much for being the great lady you are.
Thank you for coming on, and you are an amazing lady. And say hello to Rosie for me.
I will.
And I look forward to meeting him.
You will. You will. He said, now do you want me to just go wait outside for you today? Because he just knew I hadn't felt good for those 2 days. So he said, do I just need to go with you today? I said, actually, maybe you need to sit in the chair and talk to her and tell her how much better I am since I'm on your home.
I look forward to meeting him. I look forward to meeting him. And tell me, are you going to be traveling soon?
We are actually hoping that we're not going to be traveling. Last year we were at 5 or 6 different